The patient's heart flatlined at 11:47 p.m. Three surgeons stood frozen around the table, hands at their sides, eyes locked on the monitor, while the most qualified person in that room was being escorted out of the building with a termination letter in her hand. She was a travel nurse, a contract employee. Nobody. That's what they'd decided. So when she turned around, walked back through those double doors, shoved past the chief surgeon, and dropped to her knees beside that table, nobody stopped her. They just watched. And 43 seconds later, the monitor beeped. She'd done it again. She always did. Before we go any further, if you've never been here before, hit that subscribe button right now, because this channel is where the stories nobody talks about finally get told. Stories about the people overlooked, underestimated, and pushed aside until they weren't. Hit like if you're already feeling this one, drop your city and country in the comments below so I can see exactly how far this story is traveling across the world, and stay with me until the very end, because what happens to this woman will leave you speechless. The rain had been falling since noon, the kind of Pacific Northwest rain that didn't announce itself dramatically. It just arrived and refused to leave, soaking everything in a flat gray persistence that the locals had long stopped noticing. By the time the shift changed at Harlow General Medical Center in the city of Dunmore, nestled along the southern edge of Kestrel County, Oregon, the parking lot was sheeted with water, and the ER entrance was lit up orange against the dark like a wound that wouldn't close. Margaret Mara Voss. No relation to anyone, just a name that stuck to her the way uncomfortable names sometimes do, was 41 minutes into her 12-hour night shift when she noticed the new nurse. Not noticed in a friendly way. Noticed the way people in established hierarchies notice someone who doesn't fit. The new nurse was compact, maybe 5'4", with dark hair pulled back so tightly it looked like a decision, not a style choice. She moved through the supply closet with the efficiency of someone who had memorized the layout without being shown it, her hands already gloved before she'd even reached the shelf she needed. Her badge said Carter, L. Leonora Carter, travel nurse, contract duration, 90 days. She'd been on the floor for 11 days. Nobody had learned her first name yet. That was partly her fault, probably. She didn't offer much, answered direct questions directly, didn't fill silences with the nervous chatter that new nurses usually used as social currency, didn't apologize when she disagreed with a charted decision. Twice in 11 days, she had caught medication errors before they reached the patient, documented them correctly, and said nothing further about it. That should have earned her some goodwill. It had earned her something else. "You know Dr. Hargrove is looking for you," Mara said, leaning against the doorframe with her arms crossed. Nora didn't look up from the supply shelf. "I figured. You changed the dosage on 4C. The order was wrong." "That's not the point." Nora turned then. Her eyes were steady, the kind of steady that people sometimes mistook for coldness, but was actually something older and harder to name. She'd had it since she was 22 years old, though she didn't think about where it came from anymore. The patient in 4C is 67 years old, renally compromised, and Dr. Hargrove ordered a dosage calibrated for a 40-year-old at full function. So I flagged it and adjusted it within my authority and documented every step. If that's a problem, I'm happy to walk Dr. Hargrove through the pharmacokinetics. Mara blinked. "He's not going to like that." "Probably not. He runs this floor, Carter." "I know." She turned back to the shelf. "And the patient in 4C still has 2 kidneys that aren't going to fail tonight. So." She wasn't trying to be difficult. That was the thing people kept missing about her, so she genuinely wasn't performing confidence or manufacturing defiance. She just operated on a simple internal logic. Do the job correctly. Document everything. Protect the patient. Everything else was noise. She had learned that logic in a context that made Harlow General's politics feel almost cartoonish by comparison, but she never said that out loud. She'd left that context behind. She wasn't going back to it. At least, that's what she believed on day 11. Dr. Brendan Hargrove was 48, chief of emergency medicine, and had been at Harlow General for 17 years. He was not a bad doctor. He had saved lives, and he knew it, and he leaned on that knowledge the way some people lean on a single sentence written in a fortune cookie, constantly, regardless of whether it applied to the current situation. He found Nora at the nursing station at 8:10 and did not lower his voice. "I've been doing this since before you finished your nursing boards," he said, dropping the incident report on the desk between them. You want to second guess my orders? You come to me. You don't go around me. Nora looked at the report, then at him. I documented the concern in the chart and changed the dosage within the scope of my practice under Oregon nursing standards. I didn't go around you. I followed protocol. You flagged it to pharmacy without consulting me first. I consulted you in the chart. You hadn't responded in 40 minutes. A silence stretched between them. Hargrove's jaw shifted. You're a contract nurse, 90 days. You don't have the standing to second-guess my clinical decisions. My licensure doesn't have an expiration date based on employment type, Nora said. And the patient is fine. Yes, she is. The implication sat there in the air between them, clean and devastating and completely unspoken. She didn't say because of me. She didn't have to. Hargrove heard it anyway, and that was the problem. He picked up the incident report and tapped the desk once with it, a gesture that was more reflex than meaning. I'll be speaking to placement services about your assignment. He walked away. Nora watched him go, then turned back to her charts. Beside her, a younger nurse named Petra Wasilewski, fresh from a Portland nursing program, 26 years old, still at the stage where she kept her ID badge on a lanyard with her university's name on it, whispered, "You're not even a little scared of him, are you?" Nora considered this. No. Why not? She thought about it more carefully than the question probably deserved. Because I've been in situations where the wrong call meant someone died before the helicopter got there. He's uncomfortable. It's different. Petra stared at her. Where did you work before this? Nora glanced at her with something that wasn't quite a smile. Lots of places. That night was supposed to be unremarkable. A chest pain in Bay 2, a laceration requiring 8 stitches in Bay 4, a 16-year-old in Bay 1 who'd twisted her ankle badly enough to rule out a fracture, 2 intoxication holds, and a steady feed of the ordinary suffering that emergency rooms absorb 24 hours a day without comment. Then, at 11:22 p.m., the ambulance bay doors blew open. Not figuratively. A gust of actual wind came through as the bay doors activated, and the paramedic team came in fast, wheels clattering, the attending running alongside the gurney with his hand on the IV pole. Nora heard the radio traffic before she saw the patient. Short bursts of coded medical language, but also something else underneath it, something she recognized before she could name it. The rhythm of it. The particular shorthand of people who were used to working in constrained spaces under pressure, who'd been trained to strip communication down to its essential load-bearing elements. She stepped out of Bay 3 and got her first look at the patient. Male, mid-30s, lean in the way that came from physical discipline rather than circumstance. His clothing had been partially cut away in the ambulance, and what Nora could see of his torso stopped her for exactly 2 seconds. Not long enough for anyone to notice, long enough for her to process. The wounds were not consistent with the reported mechanism of injury. The paramedic's handoff mentioned a vehicle accident on Route 9, side impact, moderate speed. What Nora was looking at did not come from a vehicle accident at moderate speed. She knew what those marks were. She fell in behind the gurney automatically, checking the IV line, scanning the monitor readings clipped to the pole. The attending, Dr. Yusuf Ibarra, second year out of residency, competent and clearly overwhelmed, was already calling for imaging and reciting a list of concerns. Suspected internal bleeding, possible pneumothorax right side, BP dropping, he's been in and out. Get me a chest tray, Nora said. Ibarra glanced at her. I haven't ordered that yet. Get me a chest tray, she said again, not louder, just more precisely. The patient's blood pressure tanked on the monitor at that exact moment. Ibarra didn't argue. They were in Trauma Bay 1, and the overhead lights were too bright and everything was happening in the compressed, slightly unreal time that trauma situations created. The way a minute could contain 17 separate decisions and still feel like it was moving too slowly. Nora was already positioning herself, already scanning the patient's chest wall for the telltale signs, and she found them. The breath sounds asymmetrical, the tracheal deviation subtle but present, the neck veins starting to distend. Tension pneumothorax. The lung had collapsed and the pressure was building, compressing the heart. We need to decompress now, she said. Hargrove appeared in the doorway. He'd been paged from wherever he went when he wasn't on the floor, and he was looking at the monitors, calculating, his face running through the sequence of a diagnostic process. He was not wrong, exactly. He was just slow. need to image first, he said. We don't have time for imaging, Nora said. You don't make that call. Somebody does. The patient's oxygen saturation dropped 4 points in the time it took to say that. Ibarra was looking back and forth between them like someone caught between two gravitational fields. Nora felt the specific cold clarity that she had not felt in a long time, years, actually, settling over her like it had never left. Dr. Hargrove, she said, her voice completely level. He's going to arrest in the next 90 seconds if we don't decompress. I'm asking you to order it. Hargrove looked at the monitor, looked at the patient. Something in his face shifted. Order the needle decompression, he said to Ibarra. Nora was already moving. The patient coded at 11:47 p.m., not from the pneumothorax, she'd decompressed that, but from the secondary hemorrhage they hadn't caught in time, the one bleeding quietly in a place the initial assessment hadn't found. She'd been right about the chest. She'd also been right to be worried about the abdomen. She called the code. She ran the chest compressions personally for the first 2 minutes because the first responder was performing them too shallowly. She said, "Let me," and stepped in without asking permission, and the rhythm changed immediately, and in the controlled chaos of a code blue, she was the fixed point around which everything else organized itself. 43 seconds after the code, they got a pulse back. The patient was alive. The room exhaled. Monitors beeped. Gloves snapped off. Ibarra ran a hand over his face and let out a breath that sounded like it had been held for 20 minutes. Hargrove said nothing for a moment, then, "Good work, everyone." He did not look at Nora when he said it. She didn't care about that. She was still watching the patient's monitor, watching the heartbeat trace its unsteady line across the screen, and she was running a different calculation in her mind, one that had nothing to do with the present moment and everything to do with what she'd seen when she first looked at him. The vehicle accident story was wrong. She was certain of it now, not just instinctively but evidentially. The wound pattern was specific enough that she'd have recognized it anywhere. She'd treated it before, in conditions that made this trauma bay look like a surgical suite in a Swiss teaching hospital. The scars on his forearms, the muscle distribution, the things she'd noticed and not mentioned, a faded unit tattoo on his upper left rib cage, half covered by a bandage now, but she'd seen enough of it. This man had not been in a car accident. This man had been extracted from somewhere and dropped at her hospital in the middle of the night with a cover story stapled to him like a price tag. She didn't say any of this. She documented her nursing interventions accurately and completely, turned the patient over to the ICU team, cleaned up the trauma bay, and finished her shift. She was off at 7 in the morning. She drove home in the rain, showered, ate half a piece of toast because she wasn't hungry, and lay on top of her covers in her rental apartment 3 miles from the hospital, staring at the ceiling. She'd been in 12 states in 4 years. She'd worked in rural hospitals and urban trauma centers, and a free clinic in New Mexico for 3 months when she needed the work and the money to follow. She'd been good at all of it. She'd always been good at the work. The work was the one part of her life that had never failed her, that had never become complicated by the things that happened when you let people close enough to complicate things. She fell asleep at 8:15. She was back at the hospital by noon. The incident report arrived in the afternoon, which was earlier than she'd expected. She hadn't expected none. She knew Hargrove well enough by now to know there would be one, but she'd expected it to be about the medication dosage event, which was the one with more procedural complexity. Instead, it was about the night before, specifically about her overstepping clinical boundaries during a trauma event and engaging in unauthorized procedures prior to physician order. She read it twice. Then she read it a third time to make sure she'd understood it correctly. She had documented every intervention. The needle decompression had been ordered by Hargrove, even if the order had come a beat after her positioning. The chest compressions were nursing scope. The code management had been textbook. "This is wrong," she said, to no one in particular. Petra was passing by. "What?" Nora handed her the report. Petra read it, her expression shifting from neutral to something more carefully controlled. "Okay," she said. "It's factually incorrect." "I know." Petra handed it back. "But it's his report. That doesn't make it correct." "Carter." Petra said her name the way you said the name of someone you were genuinely trying to help navigate something they didn't fully understand. "It doesn't matter if it's correct. He's been here 17 years. You've been here 12 days. Nora looked at the report in her hand. She thought about the patient 2 floors above her, currently in the ICU with a ventilator breathing for him, and an unknown number of people probably very invested in making sure he remained classified. She thought about the wound pattern, the tattoo, the paramedics' communication style. "I need to file a rebuttal," she said. "You can file whatever you want," Petra said quietly. "But I'm telling you what's going to happen." What happened was that placement services called her at 6:47 p.m. the following day. The woman on the phone was professionally sympathetic in the specific way that meant she was reading from a prepared script of professional sympathy while managing her own discomfort at the task she'd been assigned. The contract was being terminated, effective in 72 hours. There had been concerns raised about scope of practice violations and interpersonal conflicts with senior staff. The placement agency regretted the situation and would of course work to find Nora a new placement at another facility. Nora sat in the break room with the phone against her ear and didn't say anything for a moment. "Is there anything you'd like to note for our records?" the woman asked. "The incident report filed against me is factually inaccurate," Nora said. "I'd like to put that on record." "Of course, I'll note that." "Thank you." She paused. "Is there anything else?" "We'll send the formal paperwork to your email." "Okay." She put the phone down on the table. Through the break room window, she could see the nursing station, the hallway beyond it, the elevator bank where the ICU was 2 floors up. She could see Hargrove at the desk, talking to one of the administrators, and she could see from his posture and the administrator's body language that whatever they were discussing was going well. For him. She picked up her coffee, which had gone cold, and drank it anyway. 72 hours. She had 72 hours left in this hospital. She was not going to spend them being careful. She was not reckless. She wanted to be clear about that, at least to herself. She was not going back up to the ICU to cause a scene or insert herself into a situation she'd been formally removed from. She was not going to confront Hargrove or file complaints that she didn't have the evidence to support. She was, however, going to check on her patient. Not as his nurse. She wasn't his nurse anymore. As someone who had saved his life and had a specific, nagging, professional concern about the accuracy of the information in his chart. She timed it for the shift change, when the ICU was at its most permissive about foot traffic, and she went up with a cup of coffee and the look of someone who belonged. Nobody stopped her. She had over 11, now 13 days, learned which staff members looked at badges and which looked at posture. She walked with posture. His room was at the end of the corridor, and there was a man sitting outside it. Not a nurse. Not a hospital employee. She could tell within the first 3 steps. The chair was positioned wrong, too far from the wall, angled toward the corridor rather than the room, which was a watching position, not a waiting position. The man himself was in civilian clothes, but they were civilian clothes assembled by someone who was accustomed to a different kind of clothing. The fit was wrong in a specific way. The stillness was wrong in a specific way. He looked up when she got within 10 feet. She stopped. They looked at each other. "You're Carter," he said. It wasn't a question. She said, "I'm a nurse who worked on this patient 2 nights ago." "I know." He stood. He was big, not in a showy way, in a functional way, the kind of size that was a byproduct of a job that required it. "I know who you are." Something in her chest shifted, not quite dread, not quite recognition, an old reflex waking up. "You're not hospital security," she said. "No." "And you've been here since last night. How did you know that?" "The nurse at the station mentioned a visitor who wouldn't leave. They thought you were family." She looked at him steadily. "You're not family." His jaw shifted. For a moment he just looked at her, assessing something. "You were the one who kept him alive," he said. "He's still listed as a vehicle accident victim." "He is." "That's not what happened to him." The man's eyes were very still. "What makes you say that?" She considered carefully. She had exactly nothing to gain from this conversation, and potentially several things to lose, and she was already losing her contract, which meant she was already at a baseline of nothing. "The injury pattern wasn't consistent with the reported mechanism," she said, "and I've seen that injury pattern before. Specific context." "What context?" She let the silence stretch 2 beats. "Where I worked before this." He looked at her for a long moment. Then he said very quietly, "You should go home, Nurse Carter. Get some sleep. I've been told my contract is being terminated. I know that too. Do you know why?" He didn't answer, which was its own kind of answer. She looked at him for another moment, then at the closed door of the room, then back at him. "Is he going to be okay?" she asked. Something shifted in the man's face. Not softening exactly, more like acknowledgement. One person recognizing something in another person that they hadn't expected to find there. "He has a better chance now than he did 72 hours ago," he said. She nodded. "That's something." She turned and walked back toward the elevator. She was 11 steps away when he spoke again. "Carter." She stopped but didn't turn. "The people who filed that report against you," he said, "don't let them make you doubt what you did in that trauma bay." She stood there for a moment, her back to him, looking at the elevator doors at the end of the corridor. She didn't respond. She pressed the button and waited, and when the doors opened, she stepped in and watched the floor numbers count down and thought about what an unusual thing that was to say, and why someone who was sitting outside a classified patient's room in civilian clothes with military posture would say it specifically to her. The elevator reached the ground floor. The doors opened. Standing in the lobby, directly across from the elevator bank, were two men in dark suits who had the specific stillness of people who had just arrived and were waiting for someone. Their eyes went straight to her when the doors opened, and for a half second that was long enough to change the temperature of the room. Nobody moved. Then one of them said, "Leonora Carter?" And she knew, with absolute certainty, that the story she had been trying to walk away from had just walked up and introduced itself. She didn't move right away. That was the thing about training that went deep enough. It didn't make you faster in moments of surprise. It made you stiller. The reflex wasn't to run or to speak. It was to take exactly 2 seconds to read the room before you did anything at all. 2 seconds. Both men in dark suits, one slightly ahead of the other, the talker, the lead. The second one positioned half a step back and to the right, which was a coverage position, not a conversational one. Neither of them had hands near their bodies in a way that suggested anything other than waiting. The lobby was quiet at this hour. A handful of visitors, a security guard at the desk who was looking at his phone, a woman at the information station who was pretending not to notice the two men who'd arrived 10 minutes ago and hadn't sat down. Nora stepped fully out of the elevator and let the doors close behind her. "That's me," she said. The lead man reached into his jacket pocket and she tracked the movement, and he produced a credentials wallet and flipped it open without theater. She looked at it. Federal. Not military, not directly. A federal investigative designation she recognized from a context she hadn't operated in for years. "We'd like to speak with you," he said. "Somewhere private." "I'm not under arrest." "No, ma'am." "And I don't have to go anywhere with you." "That's correct." He held her gaze. He was maybe 45, sandy-haired, with the particular kind of tired that accumulated in people who had been doing careful, high-stakes work for a long time. "We're asking." She looked at the second man. He hadn't said anything. He was scanning the lobby with the systematic patience of someone who did that automatically and couldn't turn it off. "The hospital has a family consultation room on this floor," she said. "Second corridor, left." "We know," the lead man said. Of course they did. The consultation room smelled like artificial lavender and old carpet, which was true of every consultation room she'd ever been in. There were 4 chairs arranged around a low table, a box of tissues, a framed print on the wall of a mountain range that was scenic enough to be inoffensive and specific enough to be meaningless. Nora sat down. The lead man sat across from her. The second man remained standing near the door, which closed softly. "My name is Farrell," the lead man said. "This is Dace." She waited. "We're going to tell you some things," Farrell said. "Some of them will seem unusual. We're asking for your patience." "I've already been told my contract here is being terminated," she said, "so I have some time." Something shifted in Farrell's expression. Not surprise exactly, more like confirmation. "We know about the termination." "Okay." "We know about the incident report Dr. Hargrove filed." "Then you know it's inaccurate." "We know exactly what happened in that trauma bay 2 nights ago," Farrell said. "We have it on record." She went still. "You were recording." "The patient was under federal protection. Standard protocol for transport." He paused. "We have every intervention you performed, time-stamped, and documented, including the moment you identified the tension pneumothorax before any physician order had been issued, and the moment Dr. Hargrove issued a verbal order approximately 12 seconds after you had already begun positioning. 12 seconds. She hadn't counted it. She'd just moved. "What do you want?" she said. Farrell set a folder on the table between them. He didn't open it. "The man upstairs and the patient you saved. His name is not what's in the chart. His vehicle accident is not what happened to him. And the people who put him in that ambulance are not the people who hurt him." "I know." Farrell looked at her for a moment. "How much do you know?" "I know his injury pattern wasn't accidental. I know the unit tattoo on his left rib cage is consistent with a specific type of operational deployment. I know the paramedics who brought him in were not civilian paramedics. Their communication pattern was wrong. And I know the man sitting outside his room is not a family member or a hospital employee." She paused. "Beyond that, I don't know specifics." Dace by the door made a sound that wasn't quite a laugh, more like a breath of acknowledgement. Farrell opened the folder. The photograph inside showed a man she didn't recognize, dark-haired, maybe 38, photographed from a distance at what looked like an outdoor location. Below it were 2 lines of text she couldn't read from her angle. "His name is Marcus Teal," Farrell said. "He was an intelligence operative working a domestic corruption investigation. 3 nights ago, he was ambushed during an asset meeting. The people who ambushed him were well-resourced and well-informed, which means someone told them where he was going to be." She looked at the photograph. "The leak came from inside. That's what we're looking at." "Why are you telling me this?" Farrell put his hands flat on the table. "Because Marcus Teal is alive, and you are the reason he is alive. And he is currently the only person who can testify to what he found before he was ambushed. That testimony protects a 2-year investigation. If he dies, the investigation collapses." He looked at her directly. "You've been terminated. You're leaving this hospital in 72 hours. Before you go, we want to know if you saw anything in the trauma bay, in the chart, in the people around him. That felt wrong to you." Nora considered this. "Dr. Hargrove was very insistent about imaging before decompression," she said carefully. "Yes. In a tension pneumothorax presentation that was visually evident, that level of insistence on protocol over clinical judgment is unusual." "Yes. Imaging takes time." "It does, Farrell said. "It also creates a window." She let that sit for a moment. She had not let herself think it explicitly before now. She'd felt it, the way you felt things in the back of your mind that you didn't let come forward because they were the kind of thoughts that, once acknowledged, changed everything. "You think he was trying to slow down the treatment?" Farrell didn't answer that directly. "We think there are people connected to the network that targeted Marcus Teal who have connections to this hospital. We are not prepared to say more than that at this time." "But you're prepared to let me walk out of here in 72 hours. We can't stop the termination. We don't have jurisdiction over the hospital's HR processes." "That's not what I asked." Farrell looked at her steadily. "No, we're not going to stop it." She sat back in her chair. The fluorescent light above made a faint sound, a slight electrical hum, the kind you didn't notice until a room went quiet enough. She became aware of how tired she was. Not sleep-tired, but the kind of tired that came from 12 days of being underestimated in ways that were so persistent and mundane they accumulated like sediment. "I want a copy of the recording from the trauma bay," she said, "full timestamp documentation." "We can do that. I want the incident report Hargrove filed formally rebutted through federal channels, not just noted by my placement agency." Farrell exchanged a glance with Dace. "We can put that in motion. And I want to know that Marcus Teal has 24-hour coverage until he's stable enough to transfer." "He does." She looked at the photograph again. She didn't know this man. She'd had her hands inside his chest cavity, metaphorically, in the most urgent and intimate way one stranger could intersect with another. And she didn't know him at all. He was a problem she'd solved in a trauma bay at midnight, and he had nearly died, and he hadn't, and she was being fired for it. "Is there anything else you observed?" Farrell asked. "Not that I can prove," she said. "What can't you prove?" She stood up. "I need to think about that." She did not sleep that night. She sat in her rental apartment with a cup of coffee that she refilled twice without really drinking, and she thought about what she could prove, what she had seen, what she had felt in that trauma bay in the specific way that experienced clinicians felt things. Not intuition exactly, more like pattern recognition operating below the conscious level, the way a musician hears a wrong note before they can name what's wrong with it. Hargrove's behavior in the trauma bay had been unusual in a specific way, not incompetent. She needed to be precise about this. He was not an incompetent physician. The delay in ordering the decompression had not been the fumbling of someone who didn't know what he was looking at. It had been the hesitation of someone who knew exactly what he was looking at and was managing two separate problems simultaneously: the patient in front of him and something else that she couldn't name, but that had been present in the room the way a draft is present in a room that's otherwise warm. She had worked with people under divided loyalties before. That was not a hospital experience. That was a different kind of experience, from a different part of her life, and she did not typically let those two parts of her life touch. At 3 a.m., she opened her laptop and pulled up the chart notes from that night. Her own documented interventions, cross-referenced against the timestamps she could access through the nursing portal. She wasn't looking for anything specific. She was looking for the space between things. What she found, at 3:47 in the morning, in a quiet apartment with rain on the window again, was a notation she hadn't made and hadn't noticed until now. A consult request entered at 11:31 p.m., 16 minutes after the patient arrived, while he was still in the trauma bay, before the code, entered under Hargrove's credentials, requesting a specific specialist for a specific type of consult. Not unusual on its face. Unusual in the timing. A consult request entering at a moment when Hargrove's documented attention should have been entirely on the deteriorating patient in front of him during the window of his delay, during the exact minute she'd been pressing him to order the decompression. She sat with that for a long time. Then she took a screenshot, saved it 3 places, and went to get more coffee. The next day was her second-to-last official day, and she went in because she was contracted to go in and because she was the kind of person who didn't leave jobs unfinished even when the jobs had already left her. The atmosphere on the floor had the specific texture of a workplace that knew something was happening and had divided into 2 camps. The people who looked at her with something like sympathy they couldn't afford to express, and the people who had already realigned their behavior toward whatever was coming next. Petra fell into the first camp. She handed Nora a patient assignment list without comment and then said, very quietly, not looking at her, "HR is doing exit paperwork at 4. They asked me to remind you." "Thanks." "And Hargrove's doing rounds at 9. He's been—" She stopped. "What?" Petra looked up. There was something in her face that was more than workplace discomfort. "He's been asking about you, what you do on your breaks, whether you've been talking to anyone." Nora kept her expression neutral. "That's interesting." "I thought so too." Petra held her gaze for a moment, and there was something there, a message being communicated in the space that direct words couldn't safely occupy. "I just thought you should know." She nodded and took her patient list and went to work. She was in the middle of a medication administration at noon when her pager, a pager, because Harlow General still used them for nursing staff, which was a symptom of a whole other set of institutional problems, went off with an ICU code signal. Not a full code. A rapid response. She was already moving before she'd finished reading it. She took the stairs because the stairs were faster, and she pushed through the ICU door and was halfway down the corridor before she registered the fact that the room at the end was the one she wasn't supposed to be in, and that the man outside it, the one from the day before Dace, was on his feet and talking into something at his collar. The rapid response team was already in the room. She pushed through. Marcus Teal's blood pressure was in the basement. Not the slow drift she'd seen 2 nights ago. This was a sudden drop, the kind that had a specific cause, and she scanned the room and the monitors and the chart on the door and the IV lines and stopped at the IV lines. Something was wrong with the line, not visibly wrong. The bag looked right, the rate looked right, but the secondary port, the one used for supplemental medications, had been accessed recently. She could see it in the way the cap was seated, slightly off, the way it settled when someone had handled it but tried to reset it. "Who accessed this line in the last 2 hours?" she said. The rapid response nurse looked at her. "You're not assigned to this floor." "Who accessed this line?" A beat of confused authority, the kind that happened when someone acted with enough certainty that people forgot to check credentials. The nurse looked at the chart. There was a medication adjustment ordered at 11:40. "By whom?" "Dr. Hargrove." Nora looked at the line, then at Dace in the doorway. Dace was already on his phone. "Stop the infusion," she said. "I can't just stop the infusion right now and get a toxicology panel." The rapid response physician, who had arrived 30 seconds behind her and was absorbing the situation in real time, looked at the line, looked at Nora, looked at the chart. She could see him running the calculation, the authority question, the clinical question, the liability question. He was a good doctor. She could see him being a good doctor in real time, which meant he was doing what good doctors did, which was prioritize the patient over the politics. "Stop the infusion," he said to the nurse, "and get Tox on the phone." Nora stepped back. Her hands were shaking. She noticed that with a kind of distant interest. She hadn't had shaking hands in a clinical setting in years. The last time was overseas, in a forward operating base, in circumstances that were different in every way except the essential one. Someone was trying to kill a patient, and she was the obstacle between them. Dace appeared at her elbow. "What did you see?" The secondary port was accessed. "There's a medication order entered at 11:40 under Hargrove's credentials." She kept her voice very low. "You need to pull the security footage for this corridor for the last 3 hours." "Already requested." His jaw was tight. "You were right." "About what specifically?" "About all of it." He glanced toward the room. "We've been watching the wrong people." She wanted to ask what that meant. She didn't, because Hargrove walked into the ICU at that moment. He stopped when he saw the rapid response team in Teal's room. He stopped when he saw Nora. His face went through something complicated. Surprise and calculation, and underneath both of them, something she recognized now in retrospect that she should have recognized earlier, which was fear. Not the fear of a doctor who'd arrived to find his patient in crisis. The fear of someone who'd arrived expecting one thing and found another. "What's happening?" he said. Nobody answered for a moment. Then Dace said from behind Nora, "Dr. Hargrove, I'm going to need you to stay in the corridor." Hargrove looked at him, looked at Nora. His mouth opened. "The secondary port on the patient's IV line was accessed approximately 90 minutes ago," Dace said. "There was a medication order entered under your credentials at 11:40. We're running a tox panel on the current infusion." Hargrove's face did something then. It didn't collapse. He was a controlled man. He'd been controlling things in this hospital for 17 years, and controlled men didn't collapse in corridors. But something went out of it, some animating tension, like a wire cut. "I want to speak to legal counsel," he said. "That's your right," Dace said. "You're not under arrest at this time." "I want to speak to counsel." "Dr. Hargrove," Nora said. He looked at her. She didn't know why she spoke. There was nothing useful to say to him, nothing that would matter now. But she looked at him because she wanted him to have to look back. "He's still alive," she said. Hargrove said nothing. 72 hours ago, you tried to run out the clock in a trauma bay, and he survived anyway. Today, you tried something else, and he survived that too." She kept her voice even. Not angry. She wasn't angry exactly. She was something colder and more settled. "Whatever you thought you were going to accomplish here, you should think about whether it's worth what's coming next." He looked at her for a long moment. Then he turned and walked toward the nursing station with Dace 2 steps behind him, and she watched him go, and she felt the particular weight of a thing that had been building for days, finally beginning to tip. The tox panel came back 2 hours later. She was no longer on the ICU floor. Dace had quietly and firmly suggested she return to her own assigned floor, which she had, because she had enough self-awareness to understand that being present for what was about to happen to Hargrove was not her role and not something she needed to witness. She learned the results third hand from Petra, who had learned them from the charge nurse upstairs, who had the particular quality of expression that people got when something they hadn't expected was turning out to be true. The infusion had been altered. A sedative agent at a dose consistent with respiratory suppression in a post-operative patient. Not immediately lethal to a healthy person, but Marcus Teal was not a healthy person. He was a post-operative ICU patient with a compromised respiratory baseline, and the dosage entered under Hargrove's credentials would have, in the assessment of the toxicology team, likely caused respiratory arrest within 90 minutes. The timing of the rapid response call. 90 minutes from 11:40 was 1:10 p.m. Nora had been paged at 12:02. She had 8 minutes of margin. That was it. She sat with that in the break room with a cup of cold coffee she couldn't drink, and Petra sitting across from her not saying anything, which was the right call. There was nothing to say that was equal to 8 minutes. 8 minutes was the kind of number that lodged in a specific part of your chest and stayed there. "Security came and talked to Hargrove," Petra said eventually. And then 2 other people came and talked to him, not hospital security. Nora nodded. He left with them. Okay. Petra looked at her for a moment. She was 26 years old, and she had come into nursing with a kind of fundamental optimism about institutions that Nora recognized from a younger version of herself. A version she'd been before certain events had replaced optimism with something more functional and harder to damage. Are you all right? Nora considered this. I don't know yet. What you did today? I just looked at a line. You knew to look at a line. She didn't answer that. She thought about Farrell and the consultation room and the things she hadn't been able to prove at 3 a.m. and the screenshot she'd taken and saved in 3 places. And she thought about how none of it had required her to be exceptional. It had only required her to look carefully and to not pretend she didn't see what she saw. That was a skill she'd developed in a different place and time, and she'd spent 4 years trying to put it in a drawer and walk away from it, and it kept turning out to be the skill that mattered. Her phone buzzed. A message from an unknown number. 4 words. Room 412. Tonight. 9. She looked at it for a moment. Room 412 was the ICU. Marcus Teal was in room 412. She put the phone face down on the table. I need to finish my shift, she said. What? She almost didn't go. She sat in her car in the hospital parking lot at 8:50 with the engine running and rain on the windshield, and thought about the fact that she was supposed to be finishing paperwork for a job she'd been fired from, packing her apartment, calling the placement agency to start looking at the next contract, moving on. She was good at moving on. She had turned it into something close to a discipline. The problem was that she had looked at a line and seen what someone wanted to hide, and a man was alive because of it, and she still didn't know why he'd been targeted, what he'd found, who else was connected to the people who'd tried 3 times now to make sure he didn't survive. She had 8 minutes of margin stored in her chest like a stone. She went in. The night-charge nurse at the ICU desk was someone she didn't know, which was better, and she walked through with the same posture as before, and nobody stopped her. Dace was not at his chair outside room 412. The chair was empty. She pushed the door open. The room was dim, lit by the blue ambient glow of monitors, and Marcus Teal was awake. That was the first thing. She hadn't seen him conscious. She'd seen him as a clinical problem, as a set of injuries to be managed, as a person shaped by his wounds rather than by his face. Awake, he was different. His eyes were dark, the kind of dark that was alert even through the sedation still working through his system, and he looked at her when she came in, the way people looked at someone they'd been told about. You're Carter, he said. His voice was rough, ventilator rough, the throat still sore from the tube. Yes. Sit down. She didn't sit. She moved to the side of the bed and looked at his monitor readings out of habit, then made herself stop. You should be resting. I've been resting for 3 days. He stopped, managed a breath. I need you to understand something. Mr. Teal, the people who came after me, he said. This isn't... Another stop, another managed breath. She could hear the effort it cost him. It's not just about me. What I found, the documents, there are names. People inside federal procurement, inside certain medical supply chains, inside... He paused and looked at her with an intensity that was out of proportion to his physical condition. Hargrove wasn't just covering for them. He was one of the nodes, one of the access points. She was very still. There are others, he said. In this hospital and outside it. The investigation I was running, the people who tasked me knew there was a connection to Harlow's supply chain, but they didn't know how deep. I found out. That's why they came for me. Who else knows what you found? My handler, Farrell. He met her eyes. And now you. She stood there in the blue-lit dark of the ICU room and felt the very specific sensation of a door. She had been carefully keeping closed, opening in front of her without anyone touching the handle. Why me? She said. Why tell me? He took a moment, then, because you're the only one who looked at that line. She said nothing. Nothing. Farrell's good, Teal said. The team is good. But nobody in this hospital looked at that line except you, and that's because nobody in this hospital has done what you used to do. He paused. Before you disappeared. The monitor beeped. On the window. The distant sound of the nursing station down the corridor. You know who I am, she said. I know enough. She looked at him for a long moment. He was pale and exhausted and had been ambushed and poisoned within the span of 72 hours, and he was still running the calculation of who he could trust. And he had landed on her, the fired travel nurse with the terminated contract and the incident report filed against her, and the closed-off past that she'd been dragging behind her like something she couldn't put down. She was about to respond when the ICU door opened behind her. Not Dace, not Farrell, someone she had never seen before, in hospital administrator clothing, holding a tablet, with 2 uniformed hospital security personnel behind him. And behind them, barely visible in the corridor, a woman in a tailored suit that was too good for hospital administration, with the kind of stillness that did not belong to hospital administration. The man with the tablet looked at Nora. "Ms. Carter," he said, "you've been asked to leave this facility." She looked at Teal. He was looking at the woman in the corridor, looking at her the way you looked at something you recognized and had hoped not to see. His hand moved on the bed. Slow, deliberate, the movement of someone whose IV was limiting his range. He pressed it flat against the mattress, one finger extended, pointing, not at Nora, not at the man with the tablet, at the woman in the corridor. Nora didn't look where Teal was pointing, not immediately. That was the training again, the same reflex that had made her still in the elevator lobby, that had made her count 2 seconds before stepping out. When someone points at a threat, the untrained eye goes to the threat, and in that half second of redirected attention, you lose the room. She kept her eyes on the man with the tablet, on the 2 security personnel, cataloged them in under 3 seconds. Neither guard had a hand near anything. The man with the tablet was already looking slightly uncertain about his own authority, and only then did she shift her gaze to the corridor. The woman in the suit was gone. Not down the corridor, gone. The space where she'd been was empty, and the corridor behind the security personnel showed nothing but the long beige stretch of the ICU hallway and the nurses' station at the far end. She had moved that fast and that quietly, which was information. "Ms. Carter," the man with the tablet said again, "this is your last—" "I heard you the first time," she said. She turned back to Teal. His finger had retracted. His face was pale in the monitor glow, jaw set, and she could see what it cost him to maintain control over an expression when his body was still working through what had been done to it in the last 3 days. He was looking at the corridor where the woman had been. The look on his face was not fear. It was something more specific than fear, something that had a name she couldn't quite assign. Recognition. And the particular weight that came with recognizing something you had hoped you were wrong about. "We'll talk," he said to her. The words were quiet, carrying under the tablet man's hovering presence. "Tomorrow. I'm being escorted out of the building." "I know." His eyes moved to hers. "Tomorrow." She held his gaze for 2 seconds, then turned and walked past the security guards and the tablet man and out of the ICU, and nobody touched her, because she moved like someone who was leaving by choice, and she was. For now, she was. Farrell was waiting for her in the parking lot. Not dramatically. He was standing beside a dark blue sedan that was nondescript to the point of calling attention to itself. And he had a paper cup of coffee from somewhere and was looking at his phone, and he looked up when she approached with the expression of someone who had tracked her in and out of the building and knew exactly what had just happened. "You saw her," he said. "I saw someone. I didn't recognize her." Theo did. "Yes." She stopped in front of him. The rain had dropped to a fine mist, the kind that accumulated on fabric without feeling like anything until you were soaked. "Who is she?" Farrell drank from his coffee cup and looked out at the parking lot. "Her name is Delia Pryor. She's a senior director at a federal healthcare oversight body called the Interagency Medical Coordination Office." He paused. "On paper, she audits procurement compliance across hospital networks that hold federal contracts. And off paper, we've been trying to locate her for 6 weeks. He finally looked back at Nora. "She's the architecture. Hargrove was a node. Pryor built the network he was a node in. Medical supply contracts, procurement falsification, redirected funding from federally subsidized hospital systems. 16 facilities across 4 states. Harlow General is one of them." He paused. "Was one of them." Nora stood in the mist and processed this. She was here to see if Teal was still a problem. She was here to assess the situation, which means she came inside, which means she's either confident or desperate. Either way, she now knows the rapid response happened. She knows Hargrove is in custody. She knows Teal survived. His jaw was tight. She'll move. To do what? Destroy evidence, transfer assets. She's been preparing a contingency for 2 years. We know that much. If she activates it tonight, we lose the financial documentation. And without that, Thiel's testimony alone puts 2 or 3 people in federal court. With the documentation, we have the whole network. He looked at her directly. She was in your hospital tonight. You saw her face. She understood what he was asking before he said it. Facial identification for a federal warrant application, she said. Your witness statement, combined with the ICU security footage, gives us grounds to pursue her immediately rather than waiting for her to surface again. He paused. She'll go to ground. She's good at disappearing. I can see that. I need it tonight. She looked at him. The mist was in her hair. She was 2 days from the end of a contract she'd already been terminated from, in a parking lot, being asked to make a statement that would put her name on a federal document connected to a case she'd entered by accident because a man's heart had stopped and she'd been the closest person to him who knew what to do. Tomorrow I have exit paperwork, she said. I know. What happens after I sign it? Farrell was quiet for a moment. That depends on the next 12 hours. She gave the statement in the back of Farrell's sedan, which was warm and smelled like burnt coffee and old upholstery, and Dace typed while she spoke, and it took 40 minutes because she was precise and she didn't rush precision. When she was done, Dace had 4 pages of structured testimony that included timestamps, physical description, directional movement, and the specific details she'd observed in the half-second she had available. The suit, the posture, the way the woman had been standing, not like a hospital administrator, but like someone managing sight lines. Farrell submitted it from the car while she sat in the back. What happens now? She said. We move on Pryor's last known location. We've had a secondary team sitting on it for 2 days. He looked up from his phone. And we need to move Teal. He's 2 days post-operative. I know. Moving him is a significant clinical risk. Leaving him in a hospital where Pryor just walked through the front door is a different kind of risk. He met her eyes. We have a federal medical transport team, but I want someone with him who knows his case. She saw where this was going before he said the next word. No, she said. Carter, my contract with this hospital is terminated. I'm a private citizen. I don't have a clinical relationship with this patient. You have more relevant knowledge of his injuries than anyone on my transport team. Get him a trauma surgeon. I have a trauma surgeon. I need someone who will notice if something goes wrong on a 40-minute transport when everyone else is watching the road. He said it flatly, without pressure, which was worse than pressure. It was the statement of a man who had run out of alternatives and knew it. You looked at a secondary IV port and caught what 3 nurses and an ICU physician missed. That's not about credentials. She sat with that for a long moment. What's his current oxygen sat? She said finally. Farrell pulled up a feed on his phone and turned it toward her. She looked at the numbers. Not great. Post-op respiratory compromise, the chest injury still resolving. He was stable, but the margin was narrower than she'd like for a non-clinical transport. If I'm on that transport, she said, I need full equipment access, medications, airway, chest decompression kit if the lung recompromises. And I need it in writing that any clinical decisions I make during transport are covered under Good Samaritan emergency provisions. Done. Tonight? 2 hours. She looked out the window at the hospital entrance, lit orange in the mist, the place that had fired her for saving a man's life and then nearly lost him twice more. What about Hargrove? In federal custody as of 40 minutes ago. Hospital administration has been notified. They're dealing with it. She thought about the incident report, the termination letter, the 72 hours they'd given her like it was a kindness. I want a copy of that ICU security footage, she said. The full record, every timestamp. You'll have it. Then let's go. The transport team was 4 people plus Nora, which was 2 more than a standard medical transport and enough to tell her exactly how seriously Farrell was taking the threat. They moved Teal at 1:15 in the morning, which was chosen for the same reason. Everything like this was done at 1:15 in the morning. Fewer witnesses, less traffic, narrower window for interference. She rode in the back of the transport vehicle with Teal, a paramedic named Briggs, who was competent and quiet and didn't ask her questions she didn't want to answer, and a monitoring setup that was better than she'd expected. Teal was semi-conscious through most of the transfer, which was appropriate for a man who had been critically ill 48 hours ago. He surfaced occasionally, tracked her face when she moved, and twice she caught him watching her with that same alert, dark gaze, assessing something. "Stop calculating," she said the second time. "I'm not calculating." "You are. You've been deciding something since the ICU." He was quiet for a moment. Outside, the highway was dark and wet, headlights of the escort vehicles visible through the rear windows. "What's your background?" he said. "Before nursing." "That's a long question." "We have 40 minutes. She checked his oxygen sat. Still acceptable. "Army," she said. "Medical. Attached to a forward surgical team for 2 years, then transferred to a special operations support role." "Support. That's what it was called." He made a sound that might have been acknowledgement or might have been something else. "How long ago?" "I left 4 years ago." "Why?" She didn't answer right away. Briggs was occupied with the equipment on the other side of the vehicle, which was either coincidence or professional tact. She looked at the monitor, at Teal's blood pressure reading a steady if imperfect line, at the rain sliding in horizontal streaks across the rear windows. "A mission went wrong," she said. "People died who shouldn't have. The determination afterward was that the decisions made in the field were correct given available information." She paused. "I didn't agree." "With the determination or the decisions?" "Both." He looked at her. Whatever he was calculating, it had either completed or shifted direction. "The people I was investigating," he said. "The procurement network. It's connected to medical supply contracts for active forward operating bases, not just civilian hospital systems." She went very still. "Substandard equipment. Falsified efficacy testing. Field surgical kits missing components or carrying degraded materials. Things that wouldn't show up in a standard audit but would matter in a forward setting where there's no time to check every..." He stopped. "Breath management." He was careful about how much he spent. "Soldiers have died. Not in combat. From equipment failures in the field that should not have failed." The transport vehicle moved through the dark. She looked at her hands, flat on her knees. She could feel the stone in her chest again. Not the 8 minutes from before. Something older and heavier. Something she had put down 4 years ago, and apparently not put down far enough. "How many?" she said. "That we can directly attribute?" 7 confirmed. Probable. More. She was quiet for a long time. "That's why you were telling me in the ICU," she said. "Not just because I saved your life, you needed me to understand what the stakes were." "Yes." "Because you thought I might walk away otherwise." He didn't answer that, which meant yes. She looked at him. He was genuinely exhausted, medicated, dealing with a body that had been through multiple traumas in 72 hours and still running a mission in his head. She recognized that. She'd been that person. She'd been lying in a field hospital bed with 2 cracked ribs and a decision she needed to make. And she'd made it from the bed because waiting for better circumstances was a form of giving up. "I'm not walking away," she said. "I wasn't going to." "I know that now." The transport slowed. Briggs looked up. Nora looked at the rear windows. The escort vehicle ahead had stopped. Not slowed. Stopped. In the middle of the highway, at 2 in the morning, with no visible reason. She had exactly 1 second to process that before Briggs said, "Something's wrong," and reached for his radio, and the transport vehicle's driver said a single word through the partition, a word that wasn't a word, just a sharp, compressed syllable of alarm. And then the vehicle jolted, and the lights went out, and they were moving sideways. Not an impact, a forced stop. Something across the road. Her brain registered it in the dark, even before the headlights caught the shape. A vehicle across both lanes, and the driver had done the right thing, which was swerve rather than brake, which threw the transport laterally across the shoulder gravel, and Nora had one hand braced against the wall and the other on Teal's gurney rails before the vehicle fully stopped. Dark. The engine running. Rain. Briggs already had his radio out. She could hear the driver. 2 words. Tight. Repeated. The escort vehicle's lights were still visible ahead but not moving, and she couldn't tell if that was tactical or incapacitation. "What's his SAT?" she said to Briggs. "Immediate. Patient first." 92. His voice was steady. "Good." "Dropping." The swerve had stressed the respiratory system. She moved to the oxygen controls, adjusted the flow rate, watched the number. The gurney had held, the rails she'd been holding had held, and Thiel was conscious. She could see it in the way his eyes were open and tracking, but his breathing was audible, effortful, the chest injury responding badly to acute stress. "Keep him calm," she said to Briggs, and she moved to the rear doors. "Carter," Briggs said, "I need to know what's outside." "That's not your—" "I need to know what's outside or I can't manage what's inside." She said it cleanly, no argument in it, just the logic. She put her hand on the door handle. The door opened from the outside. Dace. He was wet, breathing hard, a flashlight in his left hand. "Don't come out," he said. "Stay in the vehicle." "What happened?" "Vehicle across the road. It's empty." His eyes were scanning past her, taking in Thiel, Briggs, the equipment. "Possible diversion. We're checking. His oxygen sat is dropping." "How fast?" "Manageable for now. If it goes below 88, I have a problem." She held his gaze. "How long?" 10 minutes, maybe less." "Okay." She pulled the door back toward her, not closing it. "Leave this cracked. I need airflow and I need to hear what's happening." He didn't argue. He moved back into the dark and the rain, and she turned back to the interior. Thiel was looking at her. His oxygen sat was at 91, holding, the adjusted flow helping. His face was calm in the way that people who had been in danger enough times achieved calm. Not the absence of knowledge, but the acceptance of it. "She found us," he said. "It looks like it. She has more reach than we—" Another breath, deliberate. "More than we anticipated. Farrell's team is outside." Pryor has been 2 steps ahead of Farrell for 6 weeks. He watched her. "She knew we were moving me." She thought about that, about what it meant, about who had known the transport was happening. She could count them on one hand, and 2 of them were in this vehicle, and 1 of them was Farrell, and 1 of them was Dace, and 1 of them was the transport driver and the 2 escort vehicle operators. She stopped, went back, counted again. 1 of the escort vehicles was not moving. "Briggs," she said. "The driver. Did you know him before tonight?" Briggs looked at her. She could see him running the same calculation, 2 seconds behind her. "No, he was assigned by—" She was already moving to the partition, knocking twice, sharp. No response from the driver. She knocked again. The partition slid open 3 inches, and she could see, in the ambient light from the dashboard, that the driver's seat was empty. Not empty like he'd gotten out. The door was still closed. The seat was empty because the man who'd been in it had folded sideways, and she couldn't see well enough to assess, but she could see that he was not sitting upright and was not responding to her knock. She processed that in 1 second. The driver was down. The vehicle had stopped because the driver was down, not because of the car across the road. The car across the road was the cover. The driver was the real problem. And if the driver had been compromised before the transport began, then Pryor had known their route, their timing, their vehicle, everything. She turned around. Briggs was already on his radio, speaking quickly, coordinates and situation report, and behind him Thiel's oxygen sat read 89 and was moving. "His lung," she said. "The stress triggered a partial recollapse. I need to decompress." "Here? In the vehicle? There is nowhere else." She pulled the emergency kit from the wall bracket. Her hands were not shaking this time. She didn't know what that said about her. She had stopped asking what things said about her several years ago. "Talk to your radio. Tell them the driver is down, and I need 60 seconds of no one opening this door." Briggs relayed it. She worked. 60 seconds was an approximation. It took 90, which was the honest version of 60 in a moving vehicle on the side of a dark highway with inadequate lighting and a patient who was trying very hard to cooperate and not quite managing to stay still. She talked to Thiel through it. Not reassurance. He didn't need reassurance. He needed procedural information, which was something she understood about people who'd worked in operational contexts. She told him what she was doing as she did it, and he breathed as she instructed, and his oxygen sat had dropped to 86 before it turned, and she watched it climb back through 88 to 91 to 93 over the next 4 minutes, with something that was not quite relief, but was the functional equivalent of it. "Okay," she said. "Okay." "Nice work," Briggs said. The flatness of it was genuine. The appreciation of one professional for another, not decorated. The rear doors opened again. Dace and Farrell both this time, Farrell with his phone in hand, expression locked down in the specific way it got when things had gone wrong in a way he was already calculating the response to. "Driver's unconscious," Dace said. "Injected, we think. We need the second escort vehicle. ETA 3 minutes." Farrell looked at Teal, then at Nora. "How is he?" "Stable. Better than 3 minutes ago." She stripped her gloves. "Your driver was compromised before we left the hospital." "I know." "Which means someone on your team." "I know," he said again, and his voice was very flat and very controlled. She looked at him. There was a particular awfulness to the moment of understanding that the contamination you've been tracking in an external system exists inside your own. She'd seen it before, in different contexts, and it never looked different on the face of the person realizing it. "How long until the facility?" she said. 12 minutes with the second escort. Then we move. He's as stable as I can make him here." Farrell nodded and turned to manage the logistics, and she turned back to Teal, who was watching her with those dark tracking eyes that never quite went all the way off. And she reset his monitoring leads and adjusted the IV position and ran through the brief post-procedure check. "You should have been a field surgeon," he said. "Different path," she said. "Different path that put you in that trauma bay 3 nights ago." She didn't say anything to that. She looked at the monitor. Sat 94 and climbing, blood pressure still low but holding. He would make it to the facility. She was reasonably confident of that, which in her experience was about as confident as it was worth being. "Pryor knew the transport," she said, not a question. "Yes." "She has someone inside Farrell's team." "Almost certainly." He paused. "Farrell doesn't know who." "Does he know it's someone inside?" "He will now." He watched her. "You figured it out in about 10 seconds. The car across the road was wrong. A real roadblock stops a vehicle. That one was meant to be seen before impact, which means it was meant to trigger the swerve. The swerve stressed the patient. If I hadn't adjusted the oxygen in the first 30 seconds, the ASAT could have dropped faster. If it had gone to 85 before I caught it..." She stopped. Chose the precise word. "Deniable." I was quiet for a moment. "She's not done." "I know." "She'll come at the facility. She has to..." "The documentation I recovered is at a federal secure location, but the chain of custody runs through me. If I don't survive to testify to the recovery process, the admissibility gets complicated enough that defense counsel could..." "Mr. Teal," she said it plainly. "I know what's at stake. You told me." He stopped. 7 confirmed, she said. "Probable more." He was quiet. The second escort vehicle arrived and the transport resumed, and she sat beside his gurney and listened to the rain and the road and the monitors and did not talk for the 12 minutes it took to reach the facility. Neither did he. There was nothing more to say that was productive, and they were both, she thought, people who had learned to save words for when they mattered. The facility was a federal medical building, nondescript, accessed through a security gate, 2 armed personnel at the entrance. She helped transfer Thiel's gurney to the interior team, gave the receiving nurse a 4-minute verbal handoff that was thorough enough that the nurse wrote 3 pages of notes, and then stepped back and let them take him. She stood in the corridor. Farrell appeared beside her. He looked older than he had in the parking lot 2 hours ago, which was a thing stress did to people in concentrated doses. "We have a problem," he said. "I know." "I don't know who it is." "On the team. I have 6 people who knew the transport route and time." "You need to narrow it," she said, "tonight before Pryor has time to make contact and warn them." "How?" She thought about it. "Who confirmed the route specifically? Not the general plan, the specific highway, the specific time." 3 people. Myself, Dace, and the team coordinator, woman named Yael Maris. "Where's Maris now?" Farrell looked at her. Then he picked up his phone and dialed, and the expression on his face when it went to voicemail was not surprise so much as the grim acknowledgement of something clicking into place. "She's not answering," he said. "She was the coordinator. She could pass the route without ever being in the field tonight. She's been with the agency for 9 years. That's long enough to be recruited." Farrell dialed again. He was already moving toward the security desk, talking to someone, and she watched him go and leaned against the corridor wall and let herself, for the first time since 11:40 that night, feel the weight of what the last several hours had been. Her arms ached. The needle decompression in a moving vehicle had used muscles she didn't use in ordinary nursing practice. The physical stabilization, the resistance against the vehicle's sway. She'd managed it, but managing things didn't mean they cost nothing. She was going to feel this tomorrow. Then she thought, Pryor was still out there. Maris was not answering her phone. And somewhere in the documentation that Marcus Teal had pulled from whatever server or file or system before he'd been ambushed was the evidence that could take apart a network that had been killing people with defective medical supplies, slowly and deniably, for long enough that 7 people they knew of were dead, and probably more they didn't. She thought about that mission, 4 years ago. The one she'd told Teal about in the broadest terms. The one where she hadn't agreed with the determination. She'd walked away from the army after that, and she'd been walking in a lateral direction ever since, covering ground without getting anywhere, managing her competence in small measured doses and keeping the rest of it. The part that knew how to look at a secondary IV port and understand what it meant, the part that could run a code in a vehicle on the shoulder of a dark highway, in a closed-off place that she'd told herself she'd left permanently. She hadn't left it. She had just been waiting, without knowing it, for a reason. The sound of running came from the far end of the corridor. Not panicked running. The running of someone who had been somewhere and was returning fast because something had changed. Dace, coming from the direction of the security wing, his face hard and purposeful. "We have a location on Pryor," he said. "She's 20 minutes out and she's not alone." Nora straightened off the wall. "And TL?" Dace started. "Is stable," she said. "What do you need?" He looked at her for a half second, the look of someone recalibrating what they thought they knew about the person in front of them. Then he said, "Farrell needs to know something about the documents Thiel recovered, the specific files. He says you're the only person who can verify a section of them." "Why me?" "Because part of what Thiel found," Dace said, "has your name in it." She didn't say anything for a moment. That was not because she was surprised. Or not only that, it was because when something you have spent 4 years not thinking about surfaces in a federal corridor at 3 in the morning, with a man telling you it's in a classified document recovered from a network that has been killing people, the correct response is to take exactly as much time as you need before you open your mouth. "Show me," she said. Dace led her down the corridor and through a security door that required his badge and a PIN, and into a room that was small and fluorescent and had a table with 2 laptops on it, and Farrell sitting in front of one of them, his jacket off, his sleeves rolled, looking like a man who had been awake for 37 hours and was prepared to be awake for 37 more. He looked up when she came in. "Sit down," he said. She sat. He turned the laptop toward her. The screen showed a document, not formatted cleanly, more like a compiled record pulled from multiple sources. The kind of aggregate file that existed in investigative databases when someone had been collecting over a long period of time. Highlighted in yellow, 2/3 down the page, was a section with a name she recognized. Her name, her full name, her service number. And below it, a record of a procurement order. She read it slowly. Then she read it again. "This is from the Afghanistan deployment," she said, 4 years ago. "Yes." "The mission that went wrong." She looked up at Farrell. "We were using surgical kits from a contracted supplier. Forward surgical kit, model designations that were—" She stopped. Read the document again. "These kits were certified. I signed off on the inventory. My signature is in here." "Yes." "I signed off on them because they were presented as meeting spec. I had no reason to—" She stopped herself. This was not a conversation she should be having defensively. She went back to the document. Read the supplier name at the top. Read it again. Harlow Vantage Medical Supplies, which is a subsidiary, Farrell said, of the same procurement entity that Pryor runs through the Interagency Medical Coordination Office. She sat back. The room was very quiet. The fluorescent light above made that same faint hum she'd noticed in the consultation room at the hospital, which now felt like it had happened in a different life. She looked at the document, at her own name in a federal record she had never seen, attached to a supplier she had signed off on in good faith, in a context she had been trying not to think about for 4 years. "The mission that went wrong," she said. 2 soldiers died from injuries that should have been survivable with functioning equipment." She said it steadily, because steadiness was the only way she knew to say things that cost this much. I've spent 4 years thinking it was a field decision. Timing, triage sequence, what I chose to prioritize. It wasn't, Farrell said. The kits were defective. The hemostatic agents in the kits were degraded, stored incorrectly at origin, falsified storage records, shipped with documentation that said they were within efficacy range when they were not. He paused. We found this in Thiel's compiled files. He was building the chain of accountability, not just the financial fraud, but the downstream harm. Your mission is one of 9 documented cases where field medical equipment failure is directly attributable to Harlow Vantage's falsified certifications. 9 cases. She looked at the wall across the table and let that number be what it was. The investigation 4 years ago, she said. The after action. They cleared the field team, but they didn't look at the supply chain. No, because no one knew to look. Or because the right people made sure no one looked. He held her gaze. We don't know yet which. Thiel was getting there. He hadn't completed the accountability trace on the oversight failures. She looked back at the document. At her name. At the service number she hadn't used in 4 years, but still remembered the way you remembered the combination to a lock you'd used every day for a long time. I walked away because I thought I'd made the wrong call, she said. You made the right call with defective materials. She was quiet for a moment. Farrell didn't try to fill it. He was good at not filling things that shouldn't be filled, which she was noticing about him. What do you need from me? She said. You were present. You used those kits. You signed the inventory. Your testimony on the field condition of those materials. What you observed, what you were told, what the documentation said, corroborates Thiel's chain of evidence from the field end. He leaned forward slightly. Right now we have financial records and supply chain documentation. What we're missing is a field witness who can confirm what those kits looked like in actual deployment, what the failure mode was in practice. I can give you that. It'll put your name in a federal case. My name is already in a federal case. She nodded at the screen. You just showed it to me. She spent 50 minutes with Farrell and a second agent who appeared without introduction and took notes with the focused silence of someone whose entire job was to write down things that would later matter in court. She was precise. She had always had a good memory for clinical detail. It was one of the things that made her a good nurse and had made her a good medic before that. And she gave them dates, designations, specific observations about the material condition of the hemostatic agents, what she had noticed and had attributed at the time to field conditions rather than product failure. She had noticed something. That was the thing she hadn't let herself fully hold until now. She had noticed that the agents weren't performing as expected, and she had adjusted her technique, and she had attributed it to humidity, field contamination, the 1,000 variables that made forward surgical work different from a clean OR, and she had filed it in the category of things that happened and moved forward because moving forward was what you did. She had been right that something was wrong. She had been wrong about why. When she finished, the note-taking agent left, and Farrell poured 2 cups of terrible coffee from a machine in the corner and put one in front of her without asking, and she drank it. Pryor is 20 minutes out, Farrell said. That was 30 minutes ago. Then she's here. Her vehicle was tracked to a location 2 miles from this facility. She stopped moving 8 minutes ago. He looked at his phone. We have a team positioned, but she's not coming through the front. She came to finish it. She has to. Thiel's testimony plus your corroboration plus the supply chain documentation closes the case. If she lets this morning happen, her network collapses. She faces federal charges on 6 counts minimum. And everyone below her in the structure has every incentive to cooperate with prosecutors. He set his phone down. She's been building this for 11 years. She's not going to let it close without trying. What's the approach vector? Farrell looked at her with the expression of a man recalibrating, again, what he was dealing with. Medical wing access. We think. The facility has a service corridor that connects to an adjacent building. It was flagged as a potential vulnerability 2 days ago, but the remediation order was processed by Maris, who had not answered her phone. So the vulnerability is still open, Nora said. We're moving to close it now, but Pryor is already inside the 2-mile perimeter, and our team is spread across 3 positions. Who's with Thiel? 2 agents in the room and 1 in the corridor. He's the target. He's not the only target anymore. Farrell looked at her directly. You just gave a statement that places you as a material witness in a federal case involving 9 documented field deaths attributable to Pryor's network. You corroborated the chain of evidence. He paused. You're not incidental to this anymore. She understood what he was saying. She had understood it approximately 30 seconds into the testimony, when she'd realized that what she was providing was not supporting detail, but structural corroboration. The thing that transformed a financial fraud case into a criminal negligence and manslaughter case. That changed the exposure of everyone connected to Pryor's network. That changed what they needed to prevent. I should be with Teal, she said. I'm a material witness, not an agent. You can't assign me. But he's my patient, and I'm telling you that the safest place for both of us right now is the same room with 2 agents in it and 1 in the corridor. And that's a logic problem, not a bravery problem. Farrell looked at her. How is this not the right call? She said. He picked up his radio. The room they moved her to was not Teal's room. It was an observation room adjacent to it, with a window panel that looked into the medical bay. The kind of arrangement designed for medical monitoring, but which currently meant she could see Teal's monitors, see the 2 agents stationed in the room, and see the corridor through the window in the medical bay's door. She stood at the observation window and watched and waited. The waiting was the hard part. It always was. Action was easier than waiting because action used the parts of the brain that were good at problems, and waiting used the parts that were good at imagining all the problems that action hadn't solved yet. She thought about Pryor in the hallway of the ICU, gone that fast, that quietly. She thought about the car across the highway, the compromised driver, the way each attempt had been constructed to be deniable, not dramatic, not visible, just a quiet removal of the obstacle. That was a specific kind of mind, not a panicking mind. A methodical one, which was more dangerous than a panicking one because methodical minds didn't stop when one approach failed. They adjusted. Thiel's monitors were steady, sat 95. Blood pressure still low, normal, but improving. He was awake. She could see him from the observation window, lying with his eyes open and tracking the ceiling in the specific way of someone thinking rather than resting. She knocked once on the window. He turned his head, saw her, held her gaze. She put 2 fingers up. Okay. He nodded once, a minimal movement, and turned back to the ceiling. That was enough. The corridor lights flickered. She noticed it before she'd consciously processed it. The slight drop in luminosity, a quarter second, less. Power fluctuation. She turned to the observation room door and tried it. It opened. She stepped into the corridor and looked both ways. One of the corridor agents was coming toward her. Get back inside, he said. We have a possible breach in the service wing. Where's the second agent? Inside with the patient. Ma'am, please. The lights went out. Not a flicker. Fully out. The whole corridor. The emergency backup strips along the floor activating in red. She'd been in enough facilities to know that was a deliberate shutdown, not a failure, because failures took longer and had a sequence, and this was simultaneous and complete. She did not move toward Teal's room. She moved away from it. That was not instinct and not recklessness. It was a calculation that took under 2 seconds. The agents were with Teal. The corridor agent was moving toward the service wing, which meant the corridor between her and the service wing was currently empty. And if Pryor's approach was through the service corridor, then she was going to come through a specific door, and she was going to come in the dark because she'd arranged the dark. And the one thing she would not expect was someone between her and the target who was not an agent. Nora pressed herself against the wall beside the service corridor door and waited. 15 seconds. 20. The door opened. She could see in the red emergency light. Not well, but enough. The figure that came through was not moving like someone afraid of getting caught, moving like someone who had done this before, with a specific destination and a specific object in hand that was not a weapon, not what Nora had expected. A device, small, medical-looking, the kind of thing that could be attached to an IV line and not immediately identified as anything other than a supplemental medication delivery system. Not a gun. Of course not. Pryor didn't use guns. Pryor used deniable methods in clinical contexts. Nora stepped out from the wall. Stop, she said. Pryor stopped. They stood in the red-lit corridor 4 feet apart. Up close, she was not what Nora had expected, which was its own kind of information. She was 50-something, with the well-maintained composure of someone who had been credible in rooms of powerful people for a long time. Her face, in the red light, was almost entirely controlled. Almost. "You're the nurse," Pryor said. "Yes." "You don't have a weapon." "No." Pryor looked at her. Reading the room, the same way Nora did, the same calculation. "Move out of my way." "No." A pause. "You understand that you can't physically stop me." "I don't have to physically stop you," Nora said. "I have to keep you here for about 45 seconds. Pryor's eyes moved. One fast scan, the corridor in both directions. The agent was down the far end communicating with someone. The door behind Pryor had closed. "There are 7 people dead," Nora said, "from your supply chain, that I know of. There are probably more." Something moved in Pryor's face. Not guilt. She was past guilt, or it was buried deep enough to be functionally absent. More like the recognition of a frame she hadn't expected to be standing in. "That's a very complicated chain of— 2 of them were on my unit," Nora said. 4 years ago. I spent 4 years thinking I made the wrong call in the field. It was your product." She said it without heat, without theater. Just the fact of it, laid down between them in the red light. "I'm not moving." Pryor looked at her for a long moment. Then she moved. Not toward Nora, sideways, toward the wall, toward the secondary door that Nora had known was there, because she'd looked at the facility layout when they arrived, and she'd noted it the same way she noted secondary IV ports and exit signs, and the position of people in rooms, because that was how she moved through the world. The door opened before Pryor reached it. Dace came through it. Behind him, 2 more agents. Pryor stopped. The corridor light came back on, full fluorescent, sudden, and flat. And in the restored light, the corridor was full of people, and Pryor was standing in the middle of it with a medical device in her hand that she had not yet discarded, which meant she was still holding evidence, which meant every second she had stood talking in the dark had been a second she wasn't doing the one thing that might have helped her. 45 seconds. Nora had said 45 seconds. It had been closer to 60, but she'd been estimating conservatively. Dace looked at Pryor, then at Nora. He had the expression of someone who was going to have several questions later and was filing them for appropriate time. "Delia Pryor," he said, "you're under arrest." Pryor did not respond. She looked at Nora. One last look, the kind that was an assessment and a concession simultaneously. And then she looked away, and it was over. The facility spent the next 3 hours in the concentrated activity of aftermath, which was in some ways worse than what preceded it, because in the aftermath there were no decisions to make, and you could finally feel everything you hadn't had time to feel while you were making them. Nora sat in the same small fluorescent room with the bad coffee machine and filed a supplemental statement about the corridor encounter. She answered questions from 2 additional agents who had the careful thoroughness of people who understood that what had happened in the last 6 hours was going to be in federal court for a long time, and they needed every detail now. She gave them everything. At 6 in the morning, a pale gray light beginning to show in the single high window of the room, Farrell sat down across from her for the 3rd time and looked at her with the specific exhaustion of someone who had reached the other side of a very long night. "Pryor's in federal custody," he said. "She's not talking, but she doesn't need to. The device she was carrying is a custom-modified infusion device registered to a Harlow Vantage subsidiary. Her fingerprints are on it, and so is the substance, same sedative agent class as what was put in Thiel's line at the hospital." He paused. "That connects her directly to both attempts." "And Hargrove?" "Cooperating. He started cooperating approximately 20 minutes after he got into the federal vehicle. We think he understood that Pryor had been willing to let him take the full exposure for the ICU incident, his credentials, his order, and that whatever loyalty he felt to the network stopped at the point where he was the only one facing charges. He said it without contempt, but without sympathy. He's going to give us names. 16 facilities, you said. It's more than that. He knows 3 other physicians in the network across 2 states. She absorbed that. More nodes. More Hargroves and more hospitals, signing off on supply contracts and looking the other way and occasionally doing worse than looking away. "Yael Maris," she said, "picked up at Portland International at 5:15 a.m. She had a flight booked, one way." His expression was flat. She'd been in the network for 3 years, recruited through Pryor's oversight office, a financial arrangement, nothing ideological. She was Pryor's access point into our team. 9 years, Nora said. You said she'd been with the agency 9 years. Yes. And the last 3 she was working against it. Yes. She thought about that, about what 9 years of work meant, and what 3 years of betrayal cost, and the specific mundane horror of the fact that the compromises that enabled things like this were usually not dramatic. They started with a financial pressure or an opportunity and accumulated slowly into something unrecognizable from its starting point. What happens now, she said. Federal charges filed against Pryor by end of day. Hargrove's cooperation agreement is being drafted. The Department of Justice is taking lead on the supply chain case. That's going to take months, possibly longer. He paused. And the after-action review for the Afghanistan deployment you described, the one 4 years ago, that's going to be reopened, formally. The families of the 2 soldiers in your unit will be notified. She looked at her hands on the table. She stopped, found the right word. Good. It's going to take a time. I know how it works. She looked up. The hospital, Harlow General. Where does it stand? The administration is being briefed this morning. They're going to have to answer for the supply chain contracts they held with Harlow Vantage, and for the incident report and termination action against you, which the federal record will make very clearly retaliatory in context. He held her gaze. Your contract termination is going to be formally challenged. That process will take— I don't care about the contract, she said. Farrell looked at her. I care about whether the documentation shows what actually happened in that trauma bay, she said. I care whether the record is correct. The rest of it, the job, the placement, I'll figure that out. He was quiet for a moment. You know, I've interviewed a lot of people in a lot of rooms like this one. People who've been in situations like the one you've been in over the last 3 days. She waited. Most of them want something, he said. By this point, acknowledgement, compensation, reinstatement, an apology. Most of them have a list. I'm sure they do. You don't? She thought about her name in a classified document, about 2 soldiers and a surgical kit that had failed 4 years ago, and a determination she disagreed with that had turned out to be wrong in a way she hadn't known. About 8 minutes of margin on a highway in the dark. I want the record to be correct, she said. That's the whole list. Thiel was awake and coherent when they let her see him at 8 in the morning. He was going to need another week of medical care, minimum, and then a long exit from operational work that he would probably not take as long as it required, which was a problem for future doctors to manage. She sat in the chair beside his bed, a real chair, a facility chair, not an ICU one, and he looked at her with those dark, tracking eyes and didn't say anything for a moment. Pryor's in custody, she said. I heard. Hargrove is cooperating. Also heard. He shifted slightly, a careful movement that acknowledged the cost of shifting. You stopped her in the corridor. I kept her occupied. Dace stopped her. You kept her in place for a minute in the dark, alone, without a weapon. I miscounted. It was closer to a minute. He looked at her for a moment. Why? She considered this question. The same reason I adjusted the oxygen flow in the transport vehicle before I knew what was outside. There was a problem, and I was closest to it. That's not a complete answer. No, she said. It's not. She looked at the monitor. His SAT was 96. His blood pressure was climbing back to something that would stop worrying her within the next 12 hours. Your investigation, she said. The supply chain case. It's going to take months. At least. The documentation you recovered. Will it hold up? With everything that happened to you before you could complete the chain? Most of it. The Afghanistan section is incomplete. He looked at her. Until this morning. Her testimony. The field corroboration. Families of 7 soldiers, she said. Minimum. They're going to need to understand what happened. They will. She nodded. Carter, he said. She looked at him. What you did 4 years ago. The field decisions you made. I read the after-action summary when I was building the case. He said it carefully, the way you said things that mattered to the person you were saying them to. You made the right calls, with what you had. What you were given was the problem. She looked at the window. Gray morning, the Pacific Northwest gray she'd been living inside for 2 weeks that felt like a different unit of time entirely. She had known it intellectually, from the moment Farrell showed her the document at 3 in the morning. Knowing a thing intellectually and letting it settle into the place it needed to settle were not the same process, and she was aware that the settling was going to take longer than this morning. But it had started. "You should sleep," she said. "Probably." She stood. "I'm going to give the JD team a full deposition this week. Everything from the field. Every detail I have." "I know you will." She picked up her jacket from the back of the chair. She was still wearing hospital scrubs under it. Harlow General scrubs, blue, the ones she'd been in when this started. She would need to change. She would need a lot of things in the next several days, beginning with sleep and approximately 17 hours of not being in a building with fluorescent lights. She was at the door when he said, "There's a position." She turned. Federal Medical Witness Liaison. It's new, created specifically for cases that involve clinical expertise and chain of evidence corroboration. Field medical background, civilian nursing credentials, ability to operate in high pressure. He stopped, managed a breath. It was created about 6 months ago. It's been vacant because the right person hadn't been found. She looked at him. "Who decides?" she said. "Currently, Farrell, but the recommendation would carry weight." He met her eyes. "It wouldn't start for several weeks. There's a deposition process to get through first." She stood in the doorway for a moment, her jacket in her hand. "I'll think about it," she said. She meant it. She was not someone who said things she didn't mean, and she was genuinely going to think about it, and she was also going to sleep and eat something and sit somewhere quiet for several hours first. And she had learned enough about herself in the last 72 hours to know that the thinking would produce an answer she could trust. She walked out. The facility corridor was ordinary in the morning light, beige walls and low hum, and the distant sounds of a building coming to life, and she walked the length of it toward the exit without hurrying. She had nowhere she had to be immediately. That was an unusual feeling. She was so accustomed to the structure of shifts and assignments and the 90-day logic of contract placements that the absence of an immediate destination felt strange and slightly too large. At the end of the corridor, a door. She pushed it open. Outside, gray morning, mist coming off the parking lot, the kind of Pacific Northwest morning she had learned to stop waiting to end. Her car was here. Farrell had arranged it. She didn't know when. She walked toward it. Her phone buzzed. Not Farrell, not Dace. A number she recognized because she had been looking at it in her phone's recent calls list for 3 days. The administration line for Harlow General Medical Center in Dunmore, Oregon. She looked at it. It buzzed again. She got in her car, set the phone on the passenger seat, and started the engine. She let it ring twice more. Then she answered, "Ms. Carter." The voice was not the placement agency coordinator. It was a man's voice, older, with the careful precision of someone who had been briefed and was now doing the difficult work of a conversation he had not expected to need to have. "This is Gerald Ostroff. I'm the Chief Administrative Officer at Harlow General. I'm calling because I've just come out of a 2-hour briefing with federal representatives, and I have..." A pause. "I have a great deal to apologize for, and I'm not entirely certain where to begin." She looked through the windshield at the gray morning. "I'd suggest," she said, "with the incident report." A silence on the line. Then Ostroff said, "Yes, I suppose I would too." Another pause. Genuine, not performed. "Ms. Carter, we have a significant problem at this hospital, several significant problems. And I've been told, by the federal team, and by Dr. Hargrove's own preliminary cooperation statement, that you are the reason we still have a living patient to be concerned about." His voice was careful in a way that suggested someone who had been very confident about institutional hierarchies 3 hours ago and was now holding that confidence more carefully. "I'd like to speak with you in person, at your convenience. There are matters of your record that need to be corrected immediately, and beyond that..." He stopped. "Beyond that, I think we need to have a different kind of conversation." She watched a bird land on the parking lot edge and sit there in the mist, considering whatever birds considered in gray Oregon mornings. "I'll be available later this week," she said. "I have depositions to give first." "Of course." A breath on the line. "Miss Carter, for what it's worth, Mr. Ostroff." She said it gently, not harshly. "Let's save the rest of it for when we're in the same room. Things said over the phone have a way of being incomplete." A pause. "Yes, that's fair." "Later this week," she said. "I'll call you." She ended the call and set the phone on the passenger seat and sat for a moment in the idling car. The bird was still there on the parking lot edge. Then it wasn't. She pulled out of the lot and drove into the gray morning, and she did not think about the position Thiel had mentioned, or about Ostrov's call, or about what she was going to say to either of them. She thought about 2 soldiers and a surgical kit, and a determination she had disagreed with for 4 years. She thought about the specific texture of being wrong about why you were right. She thought about her hands on a secondary IV port in an ICU room, and a corridor in red emergency light, and a patient whose heart had stopped and started again because she had been the closest person to him who knew what to do. She drove. And 3 miles from the facility, on an empty stretch of highway where the mist was thick enough to make the road feel like the only thing left in the world, her phone buzzed one more time. Not Ostrov. Not Farrell. A number she didn't recognize. Oregon area code. She let it go to voicemail. 20 seconds later, the voicemail notification appeared. She didn't play it. She would play it later, when she was somewhere she could sit still. But the contact name that had populated against the unknown number, pulled from somewhere in her phone's data, some old record she hadn't known was still there, made her take her foot off the accelerator for just a moment. Colonel R. Vasquez. JAG. Personnel. The Army. The Army was calling her. She pulled over. Not dramatically. She eased onto the shoulder of the highway in the mist and put the car in park and sat with the engine idling and looked at the voicemail notification for a long time. Long enough that a truck passed and rocked the car slightly in its wake, and she didn't notice. Colonel R. Vasquez, JG Corbs, Judge Advocate General, Military Legal, Personnel attached. The Army did not call people casually. The Army called people when it had something to say that required a record of the saying, and the fact that Vasquez was JAG and personnel simultaneously meant this was not an administrative follow-up. This was a determination being revisited. The only determination in her history that was worth revisiting was the one she'd walked away from 4 years ago, and she had told Farrell about it at 3 in the morning, and Farrell had told someone, and the machinery had already started moving. That was fast. Too fast for comfort, she thought. Fast enough to understand that this call had probably been placed before she even left the facility, possibly while she was still sitting in the small room with the bad coffee, which meant someone with authority had made a decision and a colonel had been handed a phone number. She played the voicemail. Vasquez's voice was professional and brief, a request to return the call at her earliest convenience regarding a formal review of after-action proceedings connected to her service record. Nothing about the nature of the review, nothing about outcome or direction, just the request, the number, and a name. She listened to it twice, then set the phone down and looked at the highway. The mist was burning off at the edges. Somewhere above the cloud cover was a morning she hadn't seen yet. She had been awake for over 24 hours, and she had performed a field procedure in a moving vehicle and talked a federal target into hesitating long enough to be arrested and given 2 separate statements to federal agents, and at some point in the next several hours her body was going to stop accepting the terms of the arrangement and simply go offline. She called Vasquez back anyway. The conversation lasted 11 minutes. She pulled notes from memory. Dates, designations, the field observations she'd already given to Farrell's team. And Vasquez listened with the focused patience of someone who had been briefed and was now cross-referencing what they'd been told against the voice of the person they'd been told about. When she finished, there was a pause. "Ms. Carter," Vasquez said, "I want to be direct with you about the process. The formal review will take time. The after-action report from 4 years ago has to be officially reopened. The new evidentiary material has to be integrated, and the determination has to be reissued through the same channels the original went through. That's months, not weeks. I know how it works. But I want you to understand, and this is not standard language. This is me telling you what I can tell you this morning. The review is not a question of whether the determination was wrong. We have sufficient evidence already to establish that. The review is about producing a formal record that says it clearly enough to matter." She sat with that for a moment. Not a question of whether. "The families," she said, "will be contacted through official channels. That process has already been initiated. Is there anything I can do to support that? Your deposition with the DOJ will be part of the evidentiary record. Beyond that," a pause. "If you're willing, a personal letter to the families, kept separate from the formal record, would likely mean more than the official notification. That's not a request from this office. That's a human suggestion." "Yes, she said. I'll do that. I'll be in contact when the formal review is ready to proceed. Another pause, shorter. Miss Carter, for what it's worth, and I recognize that's a complicated phrase given the context, you conducted yourself correctly in that field operation. The record will say so. She looked out through the windshield. The mist had thinned to the point where she could see the tree line on the far side of the highway, dark green and very still. Thank you, Colonel. She ended the call, and this time she didn't sit on the shoulder of the highway. She pulled back onto the road and drove. She slept for 14 hours. She had intended 9 or 10, but her body had been waiting for permission, and when she gave it, it took what it needed. She woke at 11 the following morning to 17 unread messages, 2 missed calls from Farrell, one from a number she didn't recognize that turned out to be a DOJ attorney coordinating deposition scheduling, and one from Petra. She read Petra's message first. You're on the news, not by name, but I know it's you. Are you okay? She typed back, yes. Talk later this week. Then she got up and made coffee and stood at the window of her rental apartment and looked at the gray Dunmore morning and thought about what she was going to do next. Not in the abstract, concretely. She had a deposition on Thursday. She had a meeting with Ostroff at Harlow General on Friday. She had a letter to write to 2 families, 2 specific letters, 2 sets of names she still knew by heart. And she had a decision to make about a job offer from a man who was recovering from multiple trauma injuries in a federal medical facility and who had still managed to mention the position before she left the room, which was either admirable or slightly excessive. She suspected it was both. The deposition came first. The DOJ proceedings occupied most of Thursday, which was a long, controlled, technically demanding day in a conference room with 3 attorneys and a court reporter, and the kind of questioning that was thorough in the way federal questioning needed to be, going back over the same events from multiple angles, checking consistency, establishing the chain clearly enough that no defense argument could find purchase in the gaps. She answered every question fully and did not embellish and did not minimize, and when she didn't know something, she said she didn't know, which turned out to be the rarest thing in the room. At the end of the afternoon, one of the DOJ attorneys, a woman named Rourke, competent and precise in a way Nora respected, sat back in her chair and said, "Off the record, how are you doing with all of this?" Nora considered it. "I'm functional." "That's not the same as fine." "No," she said, "it isn't." Rourke nodded. "For what it's worth, and I know you've been hearing that phrase a lot this week, what you brought to this case is going to matter for a long time. Not just Pryor and Hargrove. The supply chain case is going to run through every facility in the network. 16 hospitals, 3 years of falsified procurement, the equipment failures in the field." She paused. "That's a lot of accountability that wasn't going to happen without the field corroboration. Someone else would have found it eventually. Maybe, but eventually is a different number of people who get hurt before it does." Nora looked at the table. "Is there a sentencing timeline for Pryor?" "She's still not cooperating, but we don't need her to cooperate. We have the device, the fingerprints, the financial documentation Thiel recovered, your testimony, 3 of Hargrove's corroborating statements, and Maris's cooperation agreement." Rourke said it with the calm of someone laying out a hand they'd already won. "Pryor is looking at federal charges on conspiracy, fraud, criminal negligence, obstruction, and attempted murder. That last one twice over if the DOJ decides to charge both the ICU incident and the transport. Her attorney is going to advise her to cooperate eventually. They always do. And Hargrove. His cooperation agreement is finalized. He gave us 2 additional physicians in the network, both in Washington state, and detailed records of the supply chain contacts he maintained over 4 years. In exchange, federal prosecutors are recommending a reduced sentence with mandatory surrender of his medical license and 5 years supervised release." Rourke looked at her steadily. "He will not practice medicine again." Nora was quiet for a moment. She thought about Hargrove in the trauma bay, the 12 seconds, the divided calculation behind his eyes that she'd read as slowness and had been something worse than slowness. She thought about what it meant to be trained to heal people and to choose otherwise, and she found that she didn't have anything clean to feel about it, just the weight of it, which was its own kind of appropriate. "Okay," she said. "The hospital is next," Rourke said. "Harlow General's administrative relationship with the Harlow Vantage supply chain is going to be part of the civil proceedings. Ostroff's meeting with you tomorrow. I'd expect him to be very motivated to reach whatever resolution you'll accept. She left the DOJ building at 6 in the evening, stepped onto a sidewalk in downtown Dunmore, and stood in the cold air for a moment. Not quite rain, not quite mist. Oregon's persistent middle ground. A bus went by. 2 people with coffee cups. Ordinary evening. She walked to her car and drove to a diner she'd eaten at twice in her 12 days at Harlow General, ordered eggs and coffee and toast, and wrote 2 letters on her phone's notepad application while the eggs got cold. They were not easy letters. She didn't try to make them easy. Easy letters about hard things were the worst kind. She'd received enough of them, as a medic and after, to know that the people reading them could feel the distance in the language, the buffering, the institutional cushion between the writer and the thing being said. She wrote both letters the way she would have spoken them, directly and without decoration, and she told each family what she'd done in the field and what she'd believed for 4 years and what she knew now, and she told them specifically what their person had done and how they had mattered, and that the record was going to say so. She sent them to Vasquez's office to be transmitted through appropriate channels, and then she ate half her cold eggs and looked at the diner window and let herself be a person sitting in a diner at the end of a very long week without anything requiring her to be anything else. Ostroff was 62 and looked like the last 5 days had aged him, a handful of additional years he hadn't budgeted for. He met her in a conference room she hadn't been in before, executive floor, different from the clinical floors she'd spent her time on, with better furniture and a window that looked out over Dunmore's low skyline and the gray reach of the river beyond it. He stood when she came in. She noticed that. He was a chief administrative officer who had been running this institution for 9 years, and he stood when she came in the room. She sat down. He sat down. "I've had 3 conversations with federal representatives this week," he said, "and I've read the full incident documentation. All of it. The trauma bay recording, the ICU footage, the toxicology results, Dr. Hargrove's cooperation statements." He put his hands flat on the table. "I'm not going to tell you I didn't know what was happening in this hospital, because I don't fully know yet what I didn't know. That investigation is ongoing. But I know what happened to you, and I know it was wrong, and I'm not going to dress that up." She looked at him. He was uncomfortable, and he wasn't hiding it, which she appreciated more than if he'd been polished. "The incident report filed by Dr. Hargrove," she said. "I want it formally withdrawn and replaced with an accurate account, not just annotated, replaced. The federal record should show what actually happened in that trauma bay." "Done. We processed that correction yesterday." "My termination. The placement agency file. The documentation they have on record. We've contacted them directly. The termination has been reclassified as an administrative error, and your record with them has been cleared." He paused. "We'd also like to offer compensation for the remaining duration of your contract, and I don't need the money," she said. "I need the record to be accurate." He stopped. "Of course." He seemed slightly off balance by this, as if he'd prepared for a negotiation and found something else in the room. Is there anything else you want from us?" She thought about it. She had thought about it since his call 3 days ago, in the slow, careful way she made decisions that mattered, and she'd arrived at something that surprised her slightly. "Your trauma protocols," she said, "the ones currently in use on the emergency floor. What about them?" "They're outdated. I noticed it in the first week. The chest trauma response sequence specifically, there's a delay built into it at the imaging stage that's inconsistent with current best evidence on tension pneumothorax management." She looked at him. "It's not the only gap. The medication verification process has a hole in it that I caught twice in 11 days. Your secondary port access documentation in the ICU is not being checked on the required cycle." Ostroff was looking at her with an expression she couldn't quite read. "I don't want to come back as a travel nurse," she said. "I have something else to figure out first. But I'm offering you 30 days of protocol review. Formal, documented, with specific remediation recommendations. In exchange for nothing except the understanding that the recommendations get implemented, not filed." "Why?" he said. It came out like he genuinely wanted to know. She looked at the window. The river beyond the city was a flat silver line under the clouds. "Because the protocols in that hospital need to be better, and I'm the person who knows what's wrong with them, and it doesn't serve anyone for me to leave that information in my head." Ostroff was quiet for a moment, then, I'll need to put together a formal consulting agreement. That's fine. The board will need to be briefed. That's also fine. He looked at her steadily. Ms. Carter, I want to say something and I want to say it correctly. This hospital treated you badly, not in one incident, in a pattern, over 12 days, that started before Hargrove filed anything. The culture that allowed a senior physician to terminate a contract nurse for being right is not a Hargrove problem. It's a systemic problem, and it was here before he was, and it'll try to persist after him if we don't do something structural. He paused. I don't know yet if I'm capable of fixing it, but I know I'm responsible for trying. She looked at him for a long moment. Start with the protocols, she said. The culture follows the practice. If you build an environment where the right clinical call is always the protected call, regardless of who makes it, that's where you start. He nodded slowly. Can I ask you something? Yes. You could have, with everything you knew, everything you had, the federal backing, you could have come in here and asked for considerably more than a protocol review. I know. Why didn't you? She picked up her jacket from the back of the chair. Because what I wanted was never the point. She stood. Call me when the consulting agreement is drafted. She met Thiel for coffee 3 weeks later, in a place that was not a hospital and not a federal facility, which was Progress. He was moving carefully, still, the way people moved when they had recently been reminded in very concrete terms what their bodies were made of, and how easily that composition could be disrupted. He'd lost weight he hadn't had to lose, and there were shadows under his eyes that were going to take longer than 3 weeks to clear. He looked, she thought, like someone who had been through something significant and was not pretending he hadn't. She respected that. They sat at a table by the window in a coffee shop in downtown Dunmore, and the gray October light came through the glass and made everything look like a photograph of itself. And he asked her what she'd decided. About the position, she said. Yes. She'd been thinking about it for 3 weeks. She'd done the protocol review at Harlow General in between. 15 days of work that produced 42 specific recommendations, all of which Ostroff had accepted without negotiation, some of which were already being implemented, and which had been the most satisfying professional work she'd done in 4 years, not because it was dramatic, but because it was correct, and it was going to matter to people who didn't know her name. She'd also thought about what Thiel had said in the transport vehicle, about the supply chain, the field equipment, the soldiers who had died from materials that should have worked and didn't. The position, she said slowly, as it was described to me, Federal Medical Witness Liaison, that's a narrow frame for what it actually requires. It is. If I take it, I want it redefined, not liaison. I want to be embedded in the review process at the procurement assessment stage, not just brought in when there's already a case and someone needs field corroboration. I want to be part of the system that catches it before it becomes a case. She looked at him. Equipment that goes to forward surgical teams should be reviewed by someone who has used it in a forward surgical environment. That's not a complicated idea. It's just apparently never been the structure. Thiel looked at her for a moment. That's a bigger ask than the position as it stands. I know. Farrell would have to go up the chain. I know that too. He wrapped his hands around his coffee cup. He had the considering expression she'd seen in the ICU and in the transport and in the facility corridor. The same calculation, constantly running. Why not go back to the Army directly? Vasquez's review is going to clear your record. The door would be open. Because I'm not a soldier anymore, she said. It came out simply, without regret. It was just true. I left for a reason, and the reason turned out to be more complicated than I understood at the time, but the leaving was still right. I'm not a nurse who wants to go back to being a medic. I'm a person who knows how both of those systems work and what the gaps between them look like. That's exactly why the position exists. Then make it what it should be, she said, and I'll take it. He was quiet for a moment. Then he smiled. It was small and slightly effortful, the smile of someone whose face was still working out the logistics of smiling again, but it was there. I'll talk to Farrell. Today, she said. Today, he agreed. She didn't leave Dunmore right away. She finished the protocol work at Harlow General, and she trained Petra and 2 other nurses on the revised chest trauma response sequence. And she sat in the break room one afternoon and drank bad coffee with a woman named Mara, who had been the first person to tell her that Hargrove was looking for her, all those days ago that felt like a different season. Mara was uncomfortable, which was appropriate, and she didn't apologize with words. She just showed up in the break room and sat down, which was its own kind of acknowledgement. I knew something was wrong, Mara said. With him, you should have said something, Nora said, not harshly. But I also know what it costs to say something in a place where the wrong person has the authority. That's a systems problem, not just a personal one. That's a generous way to look at it. It's an accurate way to look at it. She looked at her coffee cup. What you do now matters more than what you didn't do before. That's usually how it works. Mara was quiet for a moment. Are you coming back? Officially? No. She looked up. But the protocols I've put in place will be. That's the same thing, functionally. The sentencing came in stages, spread across months, as federal proceedings always were. She followed it from a distance. She had moved by then to a temporary apartment in a city closer to the federal offices where her new role was taking shape, and she received updates from Farrell and occasionally from Rourke. Delia Pryor accepted a cooperation agreement in the 11th hour, which her attorney had advised her to do 5 months earlier, and which she had resisted until the financial documentation made resistance into performance rather than strategy. She received 22 years on the primary charges, the conspiracy and fraud counts carrying the heaviest weight, with additional sentences on the obstruction and the 2 attempted murder charges running concurrently. The judge in the case read a statement during sentencing that detailed the scope of the harm. 16 hospital facilities, 3 years of falsified procurement, equipment failures documented across 9 field medical operations, 7 confirmed deaths attributed to the supply chain degradation. The statement named all 7. She read that part twice. The name she knew she'd been carrying for 4 years. The names she hadn't known she sat with quietly for a while, learning them. Brendan Hargrove surrendered his medical license on a Tuesday afternoon at the Oregon Medical Board, which was a proceeding open to the public and which approximately no one attended, because the erosion of a career happened mostly in silence, and the people it happened to were rarely allowed the dignity of an audience for it. He received 18 months in federal custody, suspended to 2 years supervised release, in exchange for the cooperation that had helped close the network. He would never practice medicine again. She did not feel the satisfaction she'd expected to feel about that, and after a while she stopped expecting to feel it, and just accepted that it was complicated, the way most real things were complicated. Yael Maris received 30 months. The betrayal of 9 years of institutional trust had a specific price, and the court named it. In January, the formal review of the after-action report from 4 years ago was reissued. The new determination was 3 pages long. The operative sentence was in the second paragraph. The field medical decisions made by Sergeant Leonora Carter on the date in question were consistent with applicable standards of care and the best information available at the time. The material failures contributing to adverse patient outcomes were attributable to equipment supplied by Harlow Vantage Medical Inc. under falsified certifications, not to field personnel judgment. She read it alone, at the desk in her temporary apartment, on a quiet January morning. She read it the way she'd read the voicemail from Vasquez, twice through, completely, letting every sentence mean what it meant. Then she put her phone down and looked out the window at a sky that was doing nothing in particular, just being winter sky, and she sat with the 4 years, not reviewing them, not adjudicating them, just acknowledging that they had happened and had cost what they'd cost, and had also, somehow and indirectly, brought her to a place where a man was alive who should have died. And 17 children of 17 families were going to grow up knowing what actually happened to their parents. And 42 protocol changes were being implemented in an emergency department in Dunmore, Oregon, by people who hadn't known her name a year ago. She did not call it balance. Life was not a balance sheet. She did not call it resolved, because some things didn't resolve. They just became the past, which was a different thing. She called it true. Finally, accurately, completely true. That was enough. Thiel came through the city in February, post-clearance, moving again at something close to his previous pace, though she suspected he was managing more discomfort than he admitted. They walked through a park because he said he'd been inside for too long, which she understood, and the February air was cold and clean, and they walked without hurrying. "The position is formally approved," he said. "Expanded scope, as you outlined." "When does it start?" "Technically, it already started. You've been doing the work for 3 months. That was true. She'd been embedded in 2 procurement reviews already, had flagged 4 supply chain concerns that were now in formal assessment, had written a 40-page recommendation for revised field equipment verification protocols that was currently sitting on someone's desk at a level of the system she couldn't quite see from where she stood, but that Farrell told her was being read. I need it in writing, she said. It is in writing. I sent it this morning. She looked at him sideways. He had, she'd noticed over the months, a particular quality of making things fait accompli and then informing you, which was either a professional habit or a personality trait, or both. She had decided she could work with it. The families, she said. Did you hear from them? He was quiet for a moment. They were passing a bare winter tree, its branches very specific against the gray sky. 2 of them responded to Vasquez's office. One wanted to speak to you directly. I know, we've been in contact. He glanced at her. How was that? She thought about the conversation, the woman's voice, the questions she'd asked, the long silences that had been full of things that words kept not quite being adequate for. Hard, she said. Right, both. They walked for a while without talking, the park quiet in the winter morning. She had found, over the past months, that she didn't need to fill silences with teal, which was a quality she valued in people and didn't often find. They had been through enough together that silence between them was a form of communication, not an absence of it. Are you okay? He said. Not a pleasantry. A real question. She thought about it the same way she'd thought about Petra's text all those weeks ago. The same honest assessment, no buffering. Better than I expected to be, she said. Not in all the ways I thought. Different ways. Different how? I thought clearing the record would be the thing that mattered most. The formal determination. She turned her collar up against the cold. It matters. But it's not the same as... She stopped, found the right word. The work. The protocols at Harlow. The procurement reviews. The family I spoke to. That's where the weight actually shifted. Because it was useful. Because it was useful and it was true, she said. The record being corrected is true, but it's retrospective. It doesn't change what happened. What you build going forward, that changes what happens next. He was quiet for a moment. That's a very practical philosophy. I'm a practical person. I've noticed. He stopped walking. She stopped too. He was looking at the bare tree they'd been passing, not at her, the way people looked at neutral things when they were saying something they weren't sure how to say directly. I wanted you on the position for obvious reasons. Clinical expertise, field experience, the specific combination of what you know and how you apply it. He paused. But I also... He stopped. Started again. When I was in that transport vehicle and the lights went out and the vehicle went sideways, I was... Another stop. I was certain it was over. I've been in situations like that before, and I've always been calculating at the same time, running it forward. That time I wasn't. I was just... He looked at her finally. And then I heard your voice, asking Briggs for the oxygen sat. Immediate, specific, correct. And I thought, okay, there's still a problem to solve. That's still possible. She looked at him. I know that's not a formal reason to build a position around someone, he said. No, she said, but it's a real one. He nodded once. They started walking again. The park was very quiet, and the winter morning was doing its thing, which was being cold and clear and indifferent to everything that had happened in the months preceding it, and she found she didn't mind that. The world's indifference to individual catastrophe and individual recovery was not hostile. It was just the scale of things, and the scale of things made it necessary to find your own reasons and build your own structure and do the work in front of you as carefully and completely as you could, because nobody was going to do it for you. And the people who needed it done couldn't wait for someone more qualified. There was no one more qualified. That was the part people kept missing. About her, about anyone who'd been overlooked long enough to start believing the overlooking. The dismissal wasn't evidence. The termination wasn't evidence. The incident report, the 90-day contracts, the being moved from placement to placement across 12 states in 4 years, none of that was evidence of who she was or what she was capable of. The evidence was in a trauma bay at midnight, in a secondary IV port she noticed when no one else did. In a corridor lit red, and a minute of standing still when moving would have been easier. In 42 protocol changes in an emergency department that would protect people she'd never meet. The evidence was what you did with what you knew. She had always known what to do. She'd just spent 4 years in hospitals that hadn't wanted to find out. That was their loss, and it was over, and the morning was cold, and she had work